Kia ora koutou, na mihi nui. No ingarangi o Kutipuna, I taimai o Kutipuna ki Aotearoa I te tau 1843. I tipu ake o ki te whanganui atara, e noho ana o ki te whanganui atara. Ko tēnei taku mihi ki ngā tangata whenua o te rohe nei, ka mihi hoki o ki ngā tohu o te rohe nei. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Thanks very much for the opportunity to be speaking to you all. Incredibly important work that you've been doing through the Healthier Lives Challenge. I hear you had a really good day at the conference yesterday, so I'll try to keep that standard up while talking to you about some of the wider socioeconomic forces, in particular the economic forces that I think sort of sit around the work that you're doing, in which the work that you're doing is embedded and which can help, or in many cases hinder, the kind of outcomes that you're trying to achieve. As Andrew said, my work is very sort of public focused and it happens in lots of different media. This is a picture from from 2012 when I lived undercover in a boarding house in Wellington to write about it for The Listener. That's a still from The Listener piece that I wrote in order to expose the kind of housing conditions that are experienced by many people on the bottom rungs of the housing ladder. And this place in Brooklyn called Malcolm's it housed about 14 people, most of them older men with alcohol problems. It was every bit as bad as it looks in that photograph, and indeed worse. It was cold, damp. The room was covered in mold spores, even though it had been cleaned, quote unquote, just before I moved in. The furniture was sort of cracked and broken. There was one working shower for 14 people. There was no washing machine. There was no fridge provided in this boarding house. So people just sort of kept their food in their own fridges in their own rooms, or it just rotted in their rooms often. There were people who were living in rooms where the windows didn't shut, so the rain just came hosing through every time it rained, which in Wellington was often, obviously. And for the dubious pleasure of staying in this place, people were being charged, and this is 12 years ago, $150 a week, with no bond, with no tenancy agreement, no paperwork, probably no tax paid either. And after the Loafers Lodge tragedy happened last year, in which 5 people lost their lives, the Listener reprinted this article in its entirety because essentially nothing has changed in the interim, which I think is a disgrace and is a subject I'm going to be doing more work on pretty shortly. And of course, those kinds of housing conditions coexist alongside things like this. A house on Auckland's Paretai Drive, which at the time it was built was the most expensive house in New Zealand, built for the now disgraced financier Mark Hodgson, who, as you may remember, his finance company went under with hundreds of millions of dollars of people's savings going with it. So with these very, very significant economic and social disparities in New Zealand, and of course they have a structuring effect on health in the wider sense. I've always been very taken by this quote from the Robert Wood Johnson Foundation and report they put out, some of you may be familiar with. It was entitled How to Talk About the Social Determinants of Health. Their first piece of advice was, don't ever use the phrase social determinants of health, because it really doesn't mean anything to the general public. But they were saying, you know, we have to start thinking of health as something that starts in our families, in our schools and workplaces, in our playgrounds and parks, in the air that we breathe, and in the water that we drink. Health starts where we live, learn, work and play, and I've always thought that's a really lovely way to put it. You can also put it more bluntly, as the WHO Commission on Social Determinants of Health did in 2008, pointing out, this will be very familiar to people in the room, I'm sure, that there is a huge socioeconomic gradient in health, and social injustice is killing people on a grand scale. So what does socioeconomic, in particular economic inequalities look like in Aotearoa, New Zealand at the moment? The first sort of image, the first graph I want to show you around this is a graph of how much of national income goes to the richest 1% in any given year. And this graph goes right back to 1920, and it rolls forward into about 2020. So we've got about a century's worth. This is a picture of how New Zealand has been in terms of economic inequality, in terms of income inequality at any rate. And this is pre-tax income. So this is basically saying of all the income that's declared every year to the Inland Revenue and its predecessors, how much of that income has gone to the richest 1%, which in New Zealand at the moment is about 40,000 people. Obviously in 1920 was a much smaller group of people. But how much has been captured by that 1%? And you can see when you go back to the 1920s, the Jazz Age, the era of sort of massive inequalities, as much, getting up to 20% of all the income in the country is going to that tiny slice of people, that 1% at the top. A bit of that gets destroyed, gets broken up through the Great Depression and 2 world wars, well, the Second World War principally. But what's most striking for me in this graph is the very steep downward slope from 1950 through to the mid-1980s, in which the share of income that's going to that richest 1% falls really consistently and dramatically across multiple different governments until it hits a low of around about 6% in the mid-80s. And that's driven by that sort of post-war social consensus that some of you will be familiar with. A world in which we had very strong trade unions, for instance, which ensured that a large share of company revenue went to ordinary rank-and-file workers. We had massive provision of social housing. We had a lot of house building generally, which made it harder to extract rents from housing for landlords, and a whole bunch of other policies that aimed to create widespread prosperity. Obviously, I'm not saying that that was a sort of paradisical time for New Zealand. Obviously, there were very limited opportunities for all kinds of groups, notably women, Māori, Pacific peoples. But in a general economic sense, it was a time of growing equality. It was also, might note, an era in which we had income taxes of top rate was around 66%, and we had inheritance taxes and all sorts of things like that. Then in the 1980s, we have the Rogernomics revolution, shift to a much more individualised, market-based view of the world, where trade unions were massively weakened, and Employment Contract Act very much weakened the bargaining power, the position of ordinary workers. We stopped providing social housing to the same extent. We cut taxes at the top. We increased taxes on the poorest New Zealanders. And that big increase in the share of income going to the top 1%, a doubling of it, in effect, back up to around 12%. That's the biggest increase in income inequality anywhere in the developed world at that time, from the mid-1980s to the mid-2000s. So something that had a huge and negative structuring effect on New Zealand as a whole. And when you get these big inequalities of income, big disparities in terms of the salaries and the wages and the benefits that people are getting, that then builds up and that turns into, that accumulates as massive inequalities of wealth, of the things that people own. This is an image from a cartoon that I worked on with a very talented Toby Morris from the Spin-Off, whose COVID illustrations many of you will know, sort of imagining all the wealth in New Zealand as if it were a 10-storey building and saying, well, who would own what in that building if wealth was a 10-storey building? And going on the data we had at the time, we understood that the richest, well, the wealthiest 1% had about 20% of all the wealth in the country. We illustrated that by saying that the 1% would have the top 2 stories all to themselves, even though there were only 40,000 people, tiny group of people. In fact, we now think that they probably have 25, 26% of all the wealth. So that very small group of people owns a quarter of the entire country. One of the consequences of that is that the poorest half of New Zealand, as you can see in the bottom left, has less than 2% of all the wealth. So 2 million adults, many of whom are actually in negative net worth, their debts are much greater than their assets, they have less than 2% of all the country's wealth. So in this illustration, they don't even have the bottom story all to themselves. They're crammed into just a proportion of it. So there are very, very large inequalities in terms of who owns things, as well as the salaries and the wages that people are earning. And of course, within those wider pictures, there are very significant intersecting inequalities. And just to pick up on one of those, when you look at median wealth, so people's net worth, their assets minus their debts, for individuals, and you break it down by ethnicity, in 2021, the last data we have for this, it's estimated that the typical Pākehā person had a net worth of about $150,000, which is getting on for 4 times that of the typical Māori person, even greater disparity for Pacific peoples, and significant disparities for people from other ethnic backgrounds as well. So all kinds of different inequalities which overlap in multiple reinforcing ways. In terms of some of the effects that has, 18 months or so ago, I wrote a column in the Post and stuff, which got a huge response, which was pointing out that you can have 2 suburbs in New Zealand that are only 30 minutes drive apart. On the left is Wadestown, one of the wealthiest parts of the country, and on the right is Waitangerua. And just on that 30-minute drive, your life expectancy declines by about 10 years. Because if you're born in an area like Wadestown, one of the richest socioeconomic areas, as a boy born there, your life expectancy is about 85. If you're a boy born in Waitangerua, your life expectancy is about 75. So these huge disparities. In terms of thinking about how these economic effects, how these inequalities and disparities affect people's health, one of the places you can start is just with the sheer material hardship that people experience. This is a graph from Statistics New Zealand data, and it's based on a survey in which families are asked, what sorts of basic things do you have to go without? What sorts of things can you not afford? And there's a list of 17 basic things that people are asked about. If they say they cannot afford at least 6 of those things, they're ranked as being in material hardship. The way this data was calculated changed in 2012, so you can see there's a bit of a gap. There's a break in the series, but ballpark you can say that in about 2010, 2011, 2012, after the global financial crisis, roughly 20% of children, because this is child material hardship, were living in families that said they couldn't afford a very large number of these basic things. Over time, and under both the last 2 governments, that has fallen to around 10%. So there are actually occasionally success stories. I think this is one of the great unacknowledged success stories of New Zealand life to an extent, albeit it's obviously insufficient. And that's been the result of the growing economy under national and then very significant minimum wage increases and benefit increases under Labour. The dots on this graph are the official targets under the Child Poverty Reduction Act 2018, which we're sort of about at the target more or less already for 2024. But the 2028 target, which both National and Labour are signed up to, would require us to drive this figure down to about 6% of children, which would be getting into being amongst the best performers in the world at that point. So it's quite an ambitious target, although whether we're going to reach it is another matter, obviously. And obviously, even though I say to some extent this is a good news story, at the same time it's incredibly concerning because you've still got 10% of children living in households with very significant material hardship. So that's ballpark 100,000 children who are living in conditions that will mark them for the rest of their lives. You probably know from the Dunedin longitudinal study that children who grow up in poverty have far higher rates of heart disease, for instance, than children who grow up in much wealthier families. But it's also true, for instance, that children who grow up in hardship have much lower reading levels at age sort of 17 or 18 than do children in wealthier families. And even when children in families that started off poor but then became wealthier throughout their childhood, they don't actually catch up to the reading scores of the wealthiest family. So even temporary poverty leaves a mark that is hard to erase. And of course, within that, again, within this figure, there are multiple intersecting inequalities. So the hardship rate for Māori and Pacific peoples for their children is about twice that of Pākehā, and it's very high for disabled children as well. When you look at the things that people are going without in the survey, there's also a very clear connection to health. So the sorts of things that people are missing out on when they turn up in this survey are things like saying, we can't afford to heat our homes. They're saying, we can't afford to go and see the GP, certainly can't afford to go and see the dentist. They're also saying we can't afford to give our children proper food, clothing, but also we can't afford to eat fruit and vegetables. We can't afford to eat meat and fish or the vegetarian equivalent at least every other day. All things you can see that would have an impact on people's health. And on the last point, the point about what food people can afford, Conservatives are sometimes inclined to say, well, maybe people just need to budget better. And so it's just, I don't think this will surprise anyone in this room, but it's worth pointing out that when the Families Commission looked at this in 2010, they found that, for instance, use of ready-to-eat food was similar across the socioeconomic spectrum. So there's not evidently some problem about people not knowing how to cook. Very large proportion of households make a shopping list before they go food shopping, plan their main meal ahead of time, all those kinds of things. And in the Families Commission survey, there were no differences between the three income groups in this respect, which to me is no surprise. People on low incomes that I've interviewed, that I've worked with in my work, have often been the best budgeters I've ever met because they've had to through force of circumstance. In addition to basic material poverty, obviously one of the other big factors, economic factors that affects people's health is the housing they live in. And again, not a massive revelation here, this is particularly true of rental housing. We have had a parade of reports about how appalling rental housing is. Brands some years ago found damp in 1/3 of rentals and mould in half of them. The Otago University study found that half of rentals would fail a basic warrant of fitness. Stats New Zealand in 2020, 1/3 of rentals have large gaps around the windows and doors. Nearly half of them are mouldy. Half of them required moderate or major repairs. Finding backed up by Habit for Humanity survey in 2022 showing that many rentals need repairs either internally or externally. And from all of that, you conclude pretty quickly that terrible quality rentals are not just sort of bad apples, as the Property Investors Federation would have us believe. When you look at the bigger picture, anywhere between 30 and 50% of rentals, so 200 to 300,000 of them, are quite significantly substandard. The previous government's healthy home standards are trying to deal with that, but it's a question mark about how effective they are. And Philippa Harden-Chapman and co have calculated that something like 230 deaths a year can be attributed to seriously bad housing. So obviously that's a huge, huge concern. And what I've just been saying, I've been very much focused on the issues for people at the poorer end of the spectrum. And sometimes that's where the debate starts and finishes. We just talk about the problems of poverty. But for me, you can't really understand deprivation without also understanding affluence. This picture doesn't make a whole lot of sense, as I've showed it to you, with just half of the seesaw. You can only really understand what's going on when you can see both halves of it, when you can also see what's happening at the upper end of the spectrum. And so in the sense, I think poverty and affluence are connected. They're all structured by the same forces. To give you just one example of this, I think one of the least appreciated facts about New Zealand economic life is that the share of company revenue that goes to wage and salary earners, so to the people on the front line, used to be about 60% back in the 1980s and has fallen to around 50% today. And that shift in revenue has been accompanied by an increasing shift, a corresponding shift in revenue going to the owners of businesses, so going to capital rather than labour. And what those sort of quite abstract numbers mean in practice is that if we'd continued the situation where wage and salary earners, people are doing the work in companies, got 60% of all the company's revenues, as they had in the 1980s, the average wage would be about $14,000 a year higher now than it actually is. And you also think about the fact that of the children who are in poverty, who I've just been talking about, 4 out of 10 of them have a parent in full-time work. And so you think about, well, why do we have such high levels of in-work poverty? It's because salaries are so low. Why are salaries so low? In part because so much more income is flowing to the people who own businesses rather than the people who work in them. In other words, poverty and affluence are directly connected, and you can't understand one without the other. And so in a sense, the problem is not just poverty, it's also economic inequality in the broader sense. It's those disparities right across the spectrum. This is a graph from the book The Spirit Level, which many of you will be familiar with, published back in 2009, in which they took a whole range of health and social problems, so things like poor educational attainment, high rates of imprisonment, high rates of homicide, high rates of teen pregnancy, low educational attainment, all those kinds of things, put them all together into an index of health and social problems, and then said, is there a connection between that and the level of income inequality, the gap between rich and poor in your country, and discovered a very, very close correlation. The countries with the widest gaps, and that's the USA out in front, quote unquote, have far and away the worst health and social problems. New Zealand, as quite an unequal country in economic terms, although not the most unequal, has quite high levels of health and social problems, just as you would expect. Now, obviously, correlation is not causation, as we all know, but there's a very plausible argument about causation, I think, in the Spirit Level's work, which has stood the test of time, which has stood repeated attacks on it as a book, on it as a body of work. And it is essentially that there is something very dysfunctional about living in a society with very large disparities between rich and poor. Those societies are ones with very large hierarchies, and they're ones which are very stigmatizing. They're ones in which people experience not just a sense of being poor in an absolute fashion, not being able to afford basic things, but they also feel themselves and they know themselves to be poorer in regards to other people. So they lack the things that other people have. And that can be very stigmatizing. It can be very shameful. Very unequal societies are also ones in which people at the lower end of the spectrum have very little control over their lives. Some of you will be familiar with Michael Marmot's groundbreaking Whitehall study, which looked at, among other things, incidents of stress-related diseases amongst civil servants in England. And he found there was a very significant gradient of stress-related disease, and it was worst at the bottom. Even though we often, well, some people think of jobs at the higher end of a hierarchy as being the most stressful, actually there is nothing more stressful than being at the bottom of a hierarchy and having no control over your lives. Very unequal societies are also very divided. They're societies in which rich and poor have very little idea of how the other half lives. So they're not very cohesive. They struggle to come together and solve social problems. There are also societies in which those at the upper end have much greater access to power. They're much better resourced to participate in democracy. They can make very large donations to political parties, and I would note the $12 million that ACT International raised in large donations between 2020 and 2023, which was about 5 times the amount that Labour and the Greens raised. They can afford to lobby, they can afford to buy full-page advertisements in newspapers opposing pro-equity social policies. They have huge influence over the direction of society. And so that's why I think a lot of the problems that we face are linked not just to poverty, but to inequality in that wider sense. And just one little recent example that's very relevant to the work that you all do, a Canadian study published last year looking at income data and community health survey data, hospitalisation and death rates, found that people who perceive themselves to be poor compared to others around them, so that's the inequality dimension, had higher rates of fatal health problems, substance use disorders, things that are often classed as the deaths of despair. Again, the causal thing, being that income inequality can provoke these feelings of shame and unhappiness that isolates people from their neighbours, and when you don't have the support and trust of the people around you, social cohesion starts to erode, things start to fall apart. This being so, that being the situation in which we live, that being sort of the water in which you all swim and work as people who are committed to equity and health equity, what then might be some of the solutions? In the time available, I can't really talk in detail about anything. I mean, this would be a whole talk in itself. But I did want to at least gesture to some areas where I think work is needed, some of the key areas. And actually the World Health Organization report I referred to at the start, I thought had a very good sort of rubric structure for these things. It said, well, one of the most crucial things for tackling social determinants of health is to address the inequitable distribution of money, resources, and power. So on that, in a sort of very general sense, obviously we need to do more to lift incomes at the bottom. The last government very significantly increased benefit rates, and that has helped alleviate, to some extent, child poverty. But there are still plenty of people on benefits who, according to the Ministry of Social Development's own research, are still anywhere between $50 to $200 a week below the poverty line, below what they need to lead a life of minimum dignity. So there's still more work needed on benefits. We also, as I said, have to address in-work poverty and the fact that 4 out of 10 poor children, as I said, have a parent in full-time work, which is just one of the many things that makes you realise that the new government's agenda, which is essentially get people off welfare and into work, is by itself certainly not going to solve poverty. I think we also need to reduce cost barriers in terms of improving people's access to resources in the sense of public services. I did some work last year for the Association of Salaried Medical Specialists that calculated that making GP services free for the entire country and dental free for the entire country would cost in the order of $3 billion a year, which might sound like a lot, but the government spends something like $140 billion a year. And actually it's an investment that would repay itself many times over, I think, in terms of better health, greater productivity, and so on and so forth. I think we need to, in terms of access to services, resources, we need to support local innovation, especially in social services. I'm thinking about a lot of the stuff that's delivered through whānau ora. I'm thinking about groups like Manaaki Tairāwhiti, who are trying to deliver joined-up social services for their people on the ground, iwi-led collectives that are trying to address the problems of fragmented and dysfunctional social services, that are trying to act as navigators, that are trying to deal with the problem of poor families, proverbially having 5 cars on the driveway from all the different social agencies that they have to deal with. Obviously, we need to fix housing, and that's a multi-spectrum thing. We need to be massively tackling the terrible quality of rental housing that I talked about. We also need to be building a huge amount more social housing. If you went back to 1990 and you thought about how much social housing we had then as a proportion of the total housing stock, if we wanted now just to maintain that, so just to maintain the level of provision we had in 1990, of social housing before we started the massive sell-offs, we are short about 40,000 state homes. That's how far provision has fallen below just keeping pace with where it was in 1990. So we really need another 40,000 state homes overnight, just about. The last government, the Labour government, built or bought about 13,000 in 6 years. So it gives you a sense of the acceleration that's needed there. We need to address tax inequalities, and again, so this is the full spectrum. This is inequality, not just poverty. Inland Revenue found last year that the wealthiest New Zealanders are paying a tax rate of 9.8%, so it's less than someone who stacks shelves in a supermarket. And that is because although income tax rates are high-ish at the upper end, we don't have a tax on capital gains. And when you're well off, a lot of your income comes as capital gains. It's from selling assets, selling houses, selling stakes in businesses. So we need something like a capital gains tax, or maybe even a wealth tax, to ensure that actually everyone is paying tax fairly on the income that they earn. And either of those taxes could easily bring in $3-4 billion a year that we could use to fund all the other things that we need to do. To the point about power, we also need to renew democracy. I think we need to find more ways for people to be engaged in democracy. We need to bring it closer to people, not blame people for not voting, for not getting engaged when the structures themselves don't work for a lot of communities. We actually need to change those structures. We need to introduce things like community-led budgeting, community control over local council budgets, citizens' assemblies, things even like Te Pāti Māori's call for a Māori Parliament. We need to be thinking about these kinds of innovations. And lastly, I think we need to have a big shift in mindset from what I'd call an extractive economy, which is what we have now, to an inclusive economy. So we have an economy that's all about extracting stuff out of the ground, for instance, extracting raw materials. It's all about extracting as much as possible out of staff and not paying them particularly well. It's about not investing now in infrastructure and things that we'll need in the future. So we're like sort of gouging stuff out of our own future. And we need to shift to an inclusive economy where we're centering people, we're investing in people, we're investing in training and retraining, we're investing in children and supporting them, ensuring that everyone has a good start in life, and where we all see ourselves as part of a collective endeavour, so that wealthier people, for instance, understand that they've done well partly through using the collective infrastructure we've all provided, driving on publicly provided roads, using a publicly provided health system, using publicly provided infrastructure like broadband. They've drawn deeply from a pool of collective resources. And in an inclusive society, they should understand that it's their role to give back deeply, to replenish that collective pool of resources so that it's there for future generations. And on a similar note, I'll just close on this image, which is one that I like because I think it works well in a bicultural, co-governance kind of sense. This is an image from Lambton Quay, from the old Mutual Life Corporation building that's near the intersection with Hunter Street. There's also an equivalent one on Queen Street in Auckland. And the image sort of in bas relief at the top comes from an old Roman sort of metaphor, and it's a guy trying to break a bunch of sticks across his knee, but failing because they are all together in a bundle. So that's an image sort of from the Western tradition, if you like, and I think it's very well matched by the whakatauki. Ki te kotahi te kākoho ka whāti, ki te kāpuia e kore e whāti. If there is only one reed, it breaks easily, but gather many together and they will not break. And I think that's the prize here from a more inclusive society. It's one that's healthier, more connected, but also one that's stronger. Kia ora koutou, thank you very much. Now, and I think we've got a little bit of time before 10 o'clock for some questions. And I'm pretty confident this is an informed and engaged audience. So we've got a couple of roving mics at the back. Who's got a question? Yes. On there.
Oh, kia ora. Is it turned on? Yes, it is. I'm Karen Brewer from the University of Auckland. Thank you. I really loved your presentation. It kind of inspires me and depresses me at the same time, because looking at your list of solutions, it seems that we don't have to be where we are. I mean, and the biggest problem we're dealing with is, I don't know, attitudes or selfishness or something. What can we do to actually move those entirely sensible suggestions any further towards reality? I don't mean they're not realistic, I mean towards becoming reality.
Yeah, absolutely. And just for the people on the live stream, I'm not sure if they're hearing everything, it's a question about how do we make possible solutions, how do we bring them closer to being real? Well, look, I mean, it's a great question and it would take a long time to answer it adequately. But briefly, I think there's a couple of things. I think we need to be able to articulate a vision for collective success. I think there's about, the top sort of 10% are doing very well, will probably never get on board, and you don't have to worry about getting those people on board because you don't ever need 100% of people in support. But you do need an argument that says, here's an agenda that will benefit 60, 70, 80% of New Zealanders, and the rest, well, they'll just have to follow suit when the reality changes. And so I think, so that's so for instance, you have to have an argument that says we're not just going to improve health services for the very poorest, we're also going to improve them for the middle classes. And it's going to be something that has mass middle class buy-in. And so that's why, for instance, I would make GP services and dental free for everyone, even though you could technically say, well, middle class people can afford it. You need stuff that's got broad buy-in. It's got to be appealing to a broad collective. The second thing, just very briefly, I would say, is you also have to be able to show that these things will work. And that sounds very prosaic, but the evidence from focus groups run by people like Peter Skilling at AUT is that when you do focus groups with people, most New Zealanders are still instinctive egalitarians, but the moment the one person who's not in a focus group says, oh, look, that's all very well, but it won't work. You can't fight the market. The market allocates salaries and wealth according to merit. It just is what it is. You can't fight it. Everyone else just crumbles. You know, and particularly after the last government spending a lot of money, not always to great effect, there's real scepticism, I think, about the idea that government can solve these problems. So although it sounds very boring and it's not as sort of sexy as doing the big picture stuff, I mean, actually stuff like, you know, I've been pleased to just read a bit about some of the work you've been doing with Healthier Lives and stuff like Hipikinga Waiora, stuff like that where you can really point, hey, look, we've got an evidence base, we did this and it works. That's incredibly powerful. So you actually have to be able to fight at the level of, is it going to work on the ground? Because that's often what people need to be convinced of.